Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
The doctor in-house today on Neighborhood Health Watch is answering questions about gynecologic cancers. More than 90,000 women are diagnosed each year with gynecologic cancer, and sadly about 28,000 die from these cancers, which have been called silent killers. Because every woman is at risk, it's important for us to know the signs and the symptoms so that cancer can be caught before it's too late. Dr. Tyler Ford with Henrico Doctors Hospital is here to talk with us today about this. What are gynecologic cancers? And there's so many different types.
Absolutely. So probably the ones that we could talk about are ovarian cancer. And ovarian cancer is kind of mixed in with fallopian tube cancer, and you have uterine cancer and cervix cancer. There's some other ones that are a little bit more rare than that, but.
And what about the symptoms? I would imagine that there are so many different symptoms for the different types of cancer. Which symptoms should women be most concerned with if they notice this?
And you're exactly right. Depending on the type of cancer, it really depends on the type of symptoms that you have. For ovarian cancer, unfortunately, they're very vague. It's abdominal pain, it's pelvic pain and pressure, it's bloating, it's not eating like you used to, and it's weight loss. And all of these are very common. For other ones, easier symptoms such as like uterine cancer, you have abnormal bleeding, and that's very simple in a woman who may be post-menopausal, who shouldn't have any bleeding anyway.
So, and at that point, you need to call your doctor, or
Absolutely.
should you have been going for screenings even before then?
So the bottom line is absolutely, you should always have that relationship with your primary care physician or your gynecologist, but any of those symptoms, all of those should be looked into.
And talk a little about prevention and what women should do to stay healthy.
Absolutely. So prevention is very important, and really when we talk about gynecologic cancers and prevention, the one that's most common is with cervix cancer, and that starts early on in life with HPV vaccinations, which has gotten a lot of publicity, as well as after 21. Patients are recommended to see their gynecologist to have pap smears, and that schedule is different kind of for everyone depending on their past history, but they should definitely be seeing.
And pay attention to
Absolutely.
your family history as well.
Family history is also important, primarily for ovarian cancer, uterine cancer. If you have a family history that's strong with different types of cancers, all of those should be looked into, and even genetic counseling should be.
All right. Dr. Tyler Ford, thank you for joining us on First and Four.